Brandon De La Val, abdominal exam. My name is Brandon De La Val. I'm going to do an abdominal exam, so I'm going to be kind of pressing down on a couple areas and listening to a couple areas. Just let me know if you're any discomfort, okay?
Okay.
So the abdomen is symmetric, a little protuberant, and I do see, looks like scar on the right lower quadrant from an appendectomy, and then had looks like a vertical scar kind of near the umbilicus where the prostate was removed, and 1, 2, 3, 4, 5 scars from that same surgery. And no rashes or lesions noted, no dilated veins, and no visible pulsations. All right, I'm going to take a listen now. A couple areas, just listening to bowel sounds. Okay. Okay, everything's like a normal active sound. And listen over your sliver and spleen. Right there. Okay, no friction rubs there. I'm gonna flip it over to the bell real quick, and I'm gonna listen over the aorta. So umbilicus, kind of midline between the umbilicus and the xiphoid process. No bruit there. Listen to the renal artery, which is kind of lateral to the aorta. No bruit there. Same on the other side. No bruit there. And the iliac, which is kind of lateral to the umbilicus. Nope. No bruit. No bruit. Kind of listen under femoral. Nope. And no bruit there. Okay. And real quick, listen over the umbilicus with the bell for any venous hums, and nothing heard there. Okay. I'm going to percuss now in the 9 areas. So, okay, towards the middle there. Any pain?
No.
Okay, tympani in all those areas. All right, now I'm going to check this liver span. So I'm going to find the bottom of the rib. Right there. Okay, I'm going to kind of wait till I hear dullness. Right there. So I'm going to mark that. I'm going to start a little bit lower and work my way up until I hear dullness. Right there. I'm going to measure that. We are about 8 centimeters. Okay, I'm going to do the same real quick with the spleen. Actually, not going to measure, but I'm just going to listen for dullness. So bottom, kind of more towards the mid-axillary. Kind of right in there, a little bit. Okay. All right. Now I'm going to palpate, light palpation first with one hand, and just tell me if you have any pain. Any pain? All right.
No.
Abdomen's non-tender, soft, no organs felt. All right. Now I'm going to do a deep palpation. So I'm going to push a little bit harder. Just let me know if you feel any pain. Any pain there?
No.
Okay. Soft and non-tender, no organs felt there. I'm now going to palpate for the spleen. So I'm going to find that bottom rib, that last rib. I'm going to put my left hand under your back. In that area. Go ahead and take a deep breath. Okay, let it out. Okay, feel it. Let me know if I'm hurting you. Feel the edge right there. Okay, and it's kind of smooth feeling. Non-tender, a little tender?
No.
No? All right, I'm gonna do the same on this other side for your spleen. Okay, and the bottom rib. And take a deep breath and let it out. This one's usually harder to find. Okay there?
Mm-hmm.
All right, that one's barely palpable. Non-tender there. All right, now I'm going to do the same kind of relax. I'm going to try to feel the kidney. This one usually is not palpable. I don't feel anything there. Kind of lateral to the umbilicus. And non-palpable there. Okay. All right, for this one, I'm going to have you sit up real quick. I'll help you up. I want you to hang your legs. Got it. Or actually, just stay right there. That might be easier. All right, I'm going to find the bottom of your ribs. I'm checking the CVA area, so where the bottom of your ribs are. Find your kidney. And I'm just going to kind of hit your back. I'm going to put my hand here and kind of hit your back area, okay? Let me know if you have any pain. Any pain?
No.
Nope. Okay. So I was kind of check the kidneys for any pain. Okay. All right, I'm checking for ascites, no bulging, anything like that around the umbilicus. All right, now I'm going to do what's called the Rossing's sign. All right, so this is check for appendicitis, so you don't have an appendix, but I would push on the left side down and kind of release real quick. And you would have, if you had an appendix, you would feel pain over on the right side. I'm assuming you didn't feel anything.
No.
All right, now I'm going to check for the psoas sign. So I'm going to put my hand, this would also check for appendicitis. I put my hand here and I want you to try to lift your leg. Okay, you would normally, anything here, any pain, you would normally feel pain because it puts pressure on those like muscles there, right by the appendix. And then the obturator sign, I'm going to bring your leg up. And I'm going to rotate, internally rotate. Any pain there on your belly?
No.
No. Okay, that would also be another sign. Okay. And then this is the Murphy sign, kind of right under the 2 hands under the right lower quadrant rib. And I want you to inhale. Any pain?
No.
Okay, that would indicate cholecystitis. All right, that's it.